So we're here with Dr. O at Glaucoma 360, and you gave a presentation today on virtual reality and visual fields. Could you elaborate more on your talk?
Absolutely. So I think one of the struggles we all face in clinical care is the fact that we often have to make important decisions about their care based on visual field tests. Some patients come from far away. They might need a caretaker to take time off in order for them to come to the clinic in order to take a visual field test. And so getting a lot of repeat tests is not a small feat. And really excellent work by Felipe Medeiros and his group has recently shown that in order to be able to detect progression, how many fields do you really need to do? And their suggestion is multiple tests at baseline, perhaps 2 tests at baseline, and then twice yearly testing subsequent to that. You should be able to pick up progression. Now the thing is if you look in more detail, even to detect fast progressors with twice yearly testing, and fast progressors defined as people who are losing -1 decibel per year, you still need 3 years to detect those fast progressors. And so the question is can we do better than that? Can we develop a more portable, low cost, easy to take, controlled environment visual field test that would allow us to detect progression more quickly? And this is a project that's in collaboration with UCSF and Vivid Vision. And I came on board as one of the glaucoma consultants, but now have some ideas about how we want to move forward with this technology. But the test is based on work done, started in the 1980s with Bertel D'Amato, who is a otolaryngologist but also interested in perimetry. And he had this sort of aha moment when he was in his hospital library in the 1980s and figured out a way in which you could kind of develop. He was trying to think of a way of developing an Amsler grid for glaucoma. So in his test, and he calls it oculokinetic perimetry, instead of the stimulus moving and the patient needing to fixate straight ahead, what happens is that the patient's eye moves in order to track the stimulus. And it makes for a much easier test, and he developed lots of different versions, paper chart versions, PowerPoint presentations, computer-based web online versions for children that involved cartoons. And now there's a new version that's been incorporated into the Vivid Vision platform. So this is a virtual reality-based test using, at this point, the examples I showed in my talk were with super threshold testing, but there is threshold testing being developed, in which patients move their head in response to stimuli, and every time they move their head to a specific stimulus, that point then becomes the fixation target for the next stimulus. So we know that the patient is looking in the direction that we think they're looking in. And the test has very good repeatability, as well as an ability. We did one of our residents, Megan Law, did a study looking at the sensitivity or the test's ability to detect the physiologic blind spot, and showed very high sensitivity for that. And now we're in the process of using threshold testing and testing our glaucoma patients and also looking at home testing, because I think also that will be a huge benefit for taking care of glaucoma patients. If you have a easy to take test, low cost, portable, home test possible, ability to take it in the home, utilizing this foveation reflex that I think is what a lot of patients find challenging in traditional visual field testing, then we might be able to overcome this inner test fluctuation that we see and really be able to detect more quickly whether patients are progressing.
So what's the next step?
So the next step, I think, in addition to threshold testing and testing in the home environment, which we've already started those projects, one thing my laboratory is interested is which ganglion cell subtypes are more vulnerable in glaucoma. And we found that there are specific subtypes that are more vulnerable. And so we want to try to design stimuli in which we can test for those specifically vulnerable ganglion cell types as a way of detecting progression more early or more quickly, and using this platform, because the other nice part about Vivid Vision's platform is that you have all this on-the-fly customizability for the particular test that you want to do, and you as the user really have full control of that, which is really nice.
Okay, and excuse me. So, what would you say is the take-home message for clinicians who are considering this?
Yeah, I think we're not quite ready for prime time, so the test is not yet available, or I wouldn't say that you should run home and buy a head-mounted device and such, but I think that this field is going to change very quickly. I think advancements are going to be made soon, and I think home visual field testing and or maybe even if it's not at home, but more frequent visual field testing that's more comfortable for the patient, I think is on the horizon.
Yeah.
And very exciting.